For Session Update, I'm Shannon Lurkey. Tuesday was Opioid Awareness Day on the Hill, and a bipartisan group of lawmakers and others called a press conference to discuss the Opioid Reform Act. Here's that press conference.
This is a historic day for us in Minnesota. We are talking about opioids. We're talking about opioid awareness and the need for real reform and the way we talk about it, the way we address it, the way we love on our families that are hurting because of it. And also, this is a day when we can talk to people and we can say, enough already. This is time to make some changes. And why in the world are we here trying to tell the medical professions how to do their job? How are we trying to fix things with legislation? That's why we're here today. And there isn't a single silver bullet that's going to fix it all. If it was, we'd have fixed it by now. Because a lot of families have been busted up, and people that have been struggling with addiction a long time have been suffering a long time. And so today is about that. We want to be open and honest. We want to talk about what we think we can do. We're introducing a number of bills, and we'll talk to those today. So overview, just quickly, we have about 8 to 10 people that are going to make some brief statements today. We've got the full branch of the state of Minnesota here behind us. We've got the Lieutenant Governor's office, we've got senators, we've got representatives, and we are saying enough already. And there isn't any one of our members I know that don't also want to participate in helping us with this. And so with that, I'm just going to tee it up a little bit with introducing who I am. My name is Dave Baker. I'm a representative here, a proud member of the House of Representatives. My son Dan died 6 years ago on March 9th, and that's what changed my life and my wife Mary's life too. He was the oldest of 3 kids. Typical story you hear so often. A back pain turned into a horrible addiction, and it spun out of control. Our wonderful doctor tried helping him initially with some pain medication that spun out of control. So we are here to ask all of the players to come to us to help fix this thing that starts in so many times with opioids, which is 2 molecules away from heroin. And let's understand the power of this thing. So that is what brought me to this moment here and why this is such a big deal to me. And we have a lot of people that could speak the same story that I just said. So we're gonna take it that way. We are standing proud. My wife and I are so proud of our son Dan. He was an amazing young man. And when you get this disease, and let me say that again, it's a disease. They didn't ask for this. This is a mental illness that we have to recognize. And we're going to wrap our arms around this disease, and we're going to continue to try to find ways to help fix people and fix their addiction, because it's a disease. No different than cancer and no different than diabetes. You have to take your medicine. You have to do the procedures to make you healthy. And we're damn determined to get people healthy again and to save lives. So today, with the help of a lot of really good people behind me, we're going to start talking about this. So thank you again for being here today. And I first want to introduce Senator Julie Rosen. She is, I want to say my counterpart, because she's a really big deal in the Senate. So she's becoming a great friend and a colleague that I have so much respect for, and we're just getting started to work together. So Senator Rosen.
Well, good morning, and thank you very much, Representative Baker. And he is a very dear friend. We have worked hard on drugs, and can't imagine what you and your family have gone through. I'm Senator Julie Rosen from District 23, and I'm very, very proud to be standing here in this press conference at Opioid Day in front of all these people back here that have a personal story of some kind and why we are so passionate about it. But frankly, I'm really tired of talking about drugs. This is my 15th session, and I have been working on drugs for the entire time, whether it's meth, Senator Meth, whether it's drugs, heroin, the PMP bill, all these tools that we're trying to get our hands around this growing drug abuse in the state. And right now, it's opiates. And I'm very proud to be the chief author of Senate File 730, which is the Opiate Product Stewardship Bill. And the role of that bill, and it's pretty aggressive, but the role of the bill is to support prescriber education, public awareness, overdose prevention program that's going to be developed. It will also support detox and aftercare. I'd like to thank the governor and the commissioner on their task force for mental health. I think that's part of the conversation. Money needs to be appropriated to support our drug courts. And I personally, after talking to all my 7 county sheriffs and the county commissioners, I would love to see some more money to the counties for child protection, because whenever you see that out-of-home placement start to rise, you know the direct correlation with drugs. And right now, it's opioids, it's meth, and heroin's just coming into my district. But we have collateral consequences, and it's our children. And I was on the governor's task force for child protection. Talk about awakening. That's the damage that we have, is our children. So I'm very, very passionate about that. The bill is basically charging a fee on the license to our manufacturers that are bringing in morphine into the state, a penny on a milligram, and on their previous sales. So it's going to be deposited into a special state revenue fund, and it will be directed towards those things I mentioned: awareness and support, and a cure for this terrible disease, as Representative Baker said. With that, thank you very much.
So then again, we'll take some, thank you. Forgot to mention at the beginning again, so at the end, we'll take questions and answers from any of the press that have any comments, or any one of the folks that have spoken or who hasn't spoken. Next up, ladies and gentlemen, we have Lieutenant Governor couldn't be here today, but in her presence is Lauren Gilchrist. So Lauren, would you please come forward from the Lieutenant Governor's office?
Good morning. I'm Lauren Gilchrist, the Governor and Lieutenant Governor's Senior Policy Advisor in Health and Human Services issues, and we really appreciate the opportunity to be a part of this event and for the leadership of Senator Rosen, Representative Baker, Senator Schoen on these important issues. These are very close to the heart of both the Governor and Lieutenant Governor, and so I'll just read this brief statement from the Lieutenant Governor. Shelley Elkington first shared the story of her daughter, Casey Jo, with me at a coffee shop in Montevideo. Casey Jo became addicted to opiate painkillers, first prescribed for her by her family doctor. She fought hard against the addiction, but in the end, it killed her. I'm also a mother, and the tragedy of Casey Jo's death at only 26 is unfathomable. This could happen to any of our children, and it does. Since 2000, deaths from opiate overdoses have increased in Minnesota by 430%. 80% of those addicted to heroin start on prescription pain medications. While the makers of these prescription painkillers are making billions in profits, Minnesotans are dying and our public health system is overwhelmed by the need for prevention, treatment, and recovery. Minnesota is taking some important first steps, but mothers like Shelley expect more, and I agree. Opioid abuse is a public health crisis that demands a coordinated response. I strongly support legislation that holds pharmaceutical companies accountable and funds prevention, treatment, and recovery for opiate addiction in Minnesota. Let's take action this legislative session to respond to the scourge of opiate addiction. Let's get help to people like Casey Jo and to the hundreds of other Minnesotans who have lost their lives. Thank you.
So legislators, when they get together, they make a bunch of rules and a bunch of laws because we think it's going to actually make a difference. Our next speaker has to actually deliver it. So Commissioner Emily Piper is also here to tell us how much she's going to work with us on this deal. So, Emily.
Well, thank you. Good morning. I'm Emily Piper. I'm Commissioner of Human Services, and I just have to say, this is just amazing energy around such an important issue, and so wonderful that the folks in this room are bringing their personal stories and the impact to the Capitol, to the legislators here today, to have these really hard conversations about the challenges we face as a state and have faced as a state regarding opiates. Just to give some context, we believe on Medicaid, we have about 5,000 chronic opioid users added to Medicaid every year. So 5,000 more people year over year become chronic users of opiates on Medicaid. We have real challenges with the number of babies born who are dependent on opiates. In the last several years, we've had double the number of babies across the state born dependent on opiates than we saw. We have real disparities across the state with American Indian babies being 8 times more likely than white babies on Medicaid to be born addicted to opiates. And as Senator Rosen said, we have real challenges downstream in costs associated with opiate dependence, as well as issues with child protection and families struggling with addiction being brought into other safety net services like child protection, and what to do as a child protection system to deal with the issues of opiate dependence. We have been trying very hard as a state to get our arms around this, and Senator Rosen mentioned the governor's task force on mental health really tackled in part the co-occurrence of chemical dependency issues that we see and mental health issues that we see across the state. And we have the great fortune, I think, is, as a state, to have real bipartisan reform efforts underway to try and continue to address these issues, particularly the disparities we see. We have the governor proposing comprehensive substance use reform disorder treatment as part of his package. We have all of these wonderful bills that these folks have dedicated their day today to come and advocate for. The issues are real, the challenges are significant, but the energy and the bipartisan support we have to try and make improvements can't be underestimated. And so I'm hopeful that we can get to work and continue to advance for the state of Minnesota on this really important issue. So thank you for having me today.
Next up is somebody who just recently brought me into her circle, and that's Attorney General Lori Swanson. She is here to talk about a very new and a cool program about getting the message out to more people, and the best way to do that. So, General Swanson, please.
Thank you. Well, first of all, I want to thank the Steve Rummler Hope Foundation for pulling this together and putting this on today. I think it's just incredible that so many people are here from so many different walks of life and communities to take part in this. The Centers for Disease Control calls the opioid epidemic one of the few public health problems that's getting worse, not better. And we've seen that in Minnesota. Last year in Minnesota, more people died from opioid overdoses than the year before. And so it's important that Minnesota double down on this problem and that we bring together the combined efforts of law enforcement, healthcare, the courts, criminal justice, and families and communities throughout our state to combat this crisis. More people die from drug overdoses right now than car accidents. And I think it's important to understand how hard addiction is when you look at the opioid epidemic in particular, just how difficult it is to overcome the addiction. One former drug addict described it this way. He said they can't eat, they can't stand up, they have stomach cramps, they have muscle aches, they can't think. All they know is they need to stop the pain. The director of a treatment center said, you don't die from withdrawal, you just wish you would have. And that's what our patients are facing. And it's incredibly important. We bring all the tools we have in the toolbox to bear, not just law enforcement, but treatment and prevention as well. Yesterday afternoon, I went to a wake of a friend of mine whose 25-year-old stepson passed away from an opioid overdose. And, this is a problem that affects every age, every gender, every race, every geography, every walk of life in Minnesota right now. And it's, as I mentioned, getting worse. Now, the government has three tools in the toolbox it can bring to bear. It can litigate, it can legislate, and it can educate, and we need to do all three. We need to continue on the law enforcement efforts, but law enforcement alone isn't going to solve this public health problem. The government can legislate, and I really want to compliment the legislators here today for all of the great work that's been done in the past to pass strong laws, but to build on those laws this year and improve them in a way that meaningfully prevents this problem. I think there's things that are really important to be done. The mandatory checking of the drug database. We have a drug database that all the opioid prescriptions go in, but if it's not being checked, then it doesn't serve the purpose as well as it could of preventing doctor shopping, pill shopping, diversion. There are 20-some states require some checking of the database before opioids are prescribed, and Minnesota should join those states in requiring that the database be checked. We need better information for consumers. People think that prescription painkillers are safe because they're lawful products that are prescribed by a doctor, and people don't have an appreciation just how dangerous they are. And I think one of the bills that's pending and is a very important one, but requiring that information be given out with those pills, not the long legal contracts that pharmaceutical companies write, but real simple information that people can understand in terms of what are the risks and how dangerous they are. Continuing education, I think, is important. We have At least 10 states require ongoing education for people in the medical community. Minnesota should join those so that people are up to date and using the best practices and the most up-to-date information. And then there's education, as Representative Baker mentioned. We proud to join forces on a Dose of Reality campaign last week. And what Dose of Reality is all about is raising awareness through public service announcements, websites, brochures, and just how dangerous these prescription painkillers are. The United States is less than 5% of the world's population. We consume 80% of the world's opioid painkillers. And it's important that people understand what these pills can do when they're not used correctly, when they're abused or misused. You know, things like don't take somebody else's pills. 70% of the pills or opioid abuse comes from people taking somebody else's pills, not buying it on the street, but friends and family members sharing the pills. It's important to lock them up in cabinets, and it's important to dispose of them properly. And there's ways to do that through take-back events and through places and communities, pharmacies, law enforcement agencies that will take them back. A lot of people don't know that, and so this Dose of Reality campaign is designed to get the word out. And there's an interactive map on the Dose of Reality website where you can go in, type in your zip code, and up will come all of the places within a 5-mile, 10-mile radius that you can take unwanted drugs to. And I think that's the goal of that campaign. And so the bottom line is we all need to come together as Minnesotans, whether it's the healthcare community, whether it's the medical community, the public safety community, the courts, the judicial branch, to really work on and tackle and prevent people from falling victim to this epidemic. So thank you very much.
So you've sort of heard now from some of the folks that will try to make a difference from a legislative standpoint, a legal standpoint. We've got the support of the governor's office, and next you're going to hear a unique perspective from an actual ER doctor, and he has a very unique message. And so a lot of the legislation that we're going to be talking about, and again, this Opioid Reform Act is what we're calling our collusion of the bills coming forward. Again, they are going to be asking doctors to prescribe less when you see a patient for the first time. We're going to ask them to check the prescription monitoring program, the database that was talked about, when you see a patient for the first time. Not every time, but we think there's certain moments in time when our prescribers, these people that want to help people, but there are times in their patient care, they need to check something to make sure these folks are actually doing what they say they're doing. We have a lot of other ideas and a lot of other bills, and we can talk about that later and offline if some of the press wants to talk about certain bills individually, because there's a lot of ideas, and actually some are still being in the works. But next, you're going to hear from Dr. Chris Johnson, and he had testimony this morning that was, again, very compelling, but Chris has a unique story, and he's been very, very active in leading our conversation in the state with this opioid crisis. So, Dr. Johnson.
Thank you very much, Representative Baker. Good morning, everyone. My name is Chris Johnson. I'm an emergency medicine doctor by training, having trained here at Hennepin County Medical Center. And I guess I want to start by apologizing that my profession couldn't stop this. You should know that this was not an accident. This epidemic was engineered. Not because necessarily everyone involved was conniving to create death, but they were pursuing incentives, and we had insufficient safeguards to stop bad medicine and bad science from continuing. My own experience began in the emergency department at Hennepin County, and you see a lot of substance abuse there, and you have the tendency to be a bit cynical and ignore, because it's a county population. There's criminal problems and broken families. But then when I moved to St. Louis Park, you realized, oh my goodness, it's everywhere. And I couldn't go a shift without seeing the effects of this crisis. Not just the ones who are not breathing and about to die, though I did see those too, but those who are out of their pain meds, their back is hurting again and they need more. And that began my investigation into the source of this problem, and I was shocked to realize there was never good scientific data that states these medicines are safe and effective long-term for chronic pain. This was pushed initially by pharmaceutical industry that had an agenda and could make billions on pain that people have as part of their life. Back pain, joint pain is something you learn to manage. We had lived as a country without needing to treat these pains this way, and other countries right in the world do that now, and they live their lives. The pharmaceutical industry couldn't do it, however, with a bit of help. And unfortunately, my profession has been exposed as being vulnerable to certain influences. At the top, with our academic leaders becoming advocates for the pharmaceutical industry. And make no mistake, these pills, oxycodone, if you look up the chemical structure of all these when you get home, they're almost identical to heroin, and there's nothing special about heroin. It's just diacetylmorphine. There's nothing morally good or bad about it. And I heard that pain was the fifth vital sign, and these medicines weren't addictive, and so we were pushing these and exposing the population at rates never seen before, and the consequence is what we're all seeing here today. Dramatically increased rates of addiction and death, and lives destroyed. And the medical profession, I think, still needs help. We still operate in a climate that we don't create by ourselves, and that's why we're working with our political and community leaders. Most docs don't want to be in a position to keep pushing this. A lot of them are very frustrated. And they didn't create this climate where we're told to make sure their pain is this, make sure they're happy with every visit, and by the way, you only have 15 minutes to see them. This creates an incentive structure that makes this problem hard to turn around, and so we're here to change that culture. But we can't do it alone. If it were just about the science and the data, we'd have fixed it by now, so a lot of us are looking for some help. I want to say that these medicines aren't evil or good. They have a use. They help with acute injuries, and they help with end-of-life care. And the people who prescribe them aren't evil either. We are trying to help people, and it was admittedly consoling to hear that these medicines weren't addictive. You can help all these people who are suffering because we do want to help suffering. But we know these medicines aren't good for these long-term sufferings. So we're going to work on changing the culture. And so going forward, without criminalizing or going after those who got caught up in this epidemic to begin with, we change the culture going forward. So we offer hope to those who suffer addiction, and we stop creating more patients who suffer from it and become at risk for it. So that's mine. Thank you very much.
Dr. Johnson, again, it takes a lot of strength to speak up like he just did, and I think we've often have thought about that, but here's one right in the trenches, and he's seeing it every single day, so thank you very much for that. Next up is somebody that I became a close friend to the moment I arrived here in St. Paul 2 years ago, and that's my good friend, Lexi Reed-Hold'em. If you haven't heard of Steve Rummler, that's why she's here, and I have never met Steve and can't now. But her story moved me greatly, so I am very proud to introduce my good friend Lexi for this one. Okay.
Thank you. Before I say anything, my daughter, Isabella, has been an advocate of passing better, safer opioid laws and helping to support all of the transitions that we're trying to create across our country to prevent people from dying and struggling with the disease of addiction, specifically to opioids. And she just wanted to take a moment to speak to you today, just a quick statement. I want to let you know also that if my 14-year-old daughter can have the courage to stand up here in front of you to do this, and believe me, she has been at so many events, that should be courage to all of you that have never done this before or that are fearful of telling your story or are fearful of saying that you're a person in long-term recovery or that you need help, to step up and actually have a voice, because your voice matters. Our legislators and our government officials cannot do this. This is a mammoth problem. Our doctors cannot do this by themselves. We need each and every individual citizen to actually stand up and do what she's doing today. Isabella Gary.
Painkiller manufacturers should be accountable for all the caused deaths. We need to pass Senate File 730 and also House File 1440.
So then I was just going to say a few words briefly too. Our bill that Isabella just spoke about is a bill that will create a licensing fee that will allow our state to raise revenue of $20 to $22 million per year. It is a simple fee. It is part of their license that already exists. It will be part of their license that already exists within the Board of Pharmacy. It's not complicated. It's 1 cent on every morphine milligram equivalent for each opioid dispensed sold the previous year. That will be only a licensing fee on the manufacturers. It will not impact cancer or hospital sales. It's all outpatient pharmacy sales. So if you have further questions about that, I'm happy to speak to it. One thing I did want to let you know, and there's so much data, and I could stand up here and give you facts after facts after facts. But to keep it moving along, because every single person up here is part of our team, and it's amazing. It is amazing that all of you are here. And it's amazing all the good work that everybody does here together. This is a nonpartisan issue. This is not one particular domain that's going to solve this problem. It's all of us together. And if you look up here, we're all from different walks of life. We're all from different organizations, and we're sitting down at the table working through this together. So the thing I want you to realize, the numbers haven't come out yet, but we did see a double-digit increase from the first half of 2016 over the first half of 2015 in opioid overdose deaths. Specifically, it's right around 15% increase. Our new age group, if we keep trending this way for the rest of 2016, the new age group that will be dying the most is 25 to 34-year-old white males. So we're seeing the exact trends that we knew would come to our state, where it's no longer the 54 to 45-year-old white males. We're seeing it come down into our youth. And with that, I want to also tie that into, why is it important for pharma, the manufacturers, to be responsible for this issue, to clean it up, to create some revenue to support solutions? Because they created it. And a couple years ago, the FDA passed new legislation that allows our doctors to now prescribe these deadly opioids that we know it's the #1 cause of accidental death in our country. They are now prescribing it to 11-year-olds. Okay, so how that can happen, I am not really sure. How we can know that this is causing the #1 cause of accidental death in our country in older populations. And now, when you go to your doctor's office, your really good, well-intended doctor is likely to prescribe your child opioids without assessing whether they are genetically predisposed, without assessing whether they have addictive behaviors. And I can tell you, lastly, that the manufacturers of prescription painkillers like OxyContin, Vicodin, and fentanyl spent $880 million on campaign contributions and lobbying initiatives from 2006 through 2015. So what I want to tell you is, our chief author, Senator Rosen, our chief author, Representative Baker, Senator Eaton, all of our Senator Schoen, all of our representatives and senators, they need your support, because there are lobbying efforts to not pass legislation that holds the manufacturers of opioids responsible for funding some of the solutions. And we still need to stop prescribing the way we're prescribing. But in the meantime, we need a continuum of care, from detox that is specific for opioid addiction all the way through sober living. For every single citizen in this state, there is no reason why we should continue to treat this as a moral failing. We can create solutions. People do not have to die. We need prescriber education, overdose prevention, and a continuum of care. And families and drug courts and supports to all of our systems. Thank you very much.
We have a few speakers left, and the next one is, again, somebody who had been mentioned already, and that's, again, somebody who is facing the same loss that we faced, and she is about as passionate about this as anybody you'll ever meet in your life. Shelley Elkington will come back or come forward, and let's talk about Casey, Joe.
always feel a little out of my element up here with all these professionals. But first I want to say how honored I am to be. I mean, this is probably the most collective group. I've done a few press conferences, and I have never seen a group really come together like this. So I want to thank everybody here for that first. Again, I did meet with, last fall, I met with Lieutenant Governor Tina Smith in Montevideo. And she had heard about Casey Joe's story, and she wanted to know more about it. So she looked me up, and we had a talk. And she was really getting educated at that time, too. I was filling her in on the struggles that Casey had, and she really wanted to make a difference. We started talking about a piece of legislation that the Steve Rummler Foundation and Lexi had already been kind of brainstorming, and that's the opiate stewardship bill that's been talked about a couple times here. Senate File 730, House File 1440. And that's what I'm really passionate about here. Dave will say how passionate I am. That's because he gets my emails. He still likes me, so that's good. But this is the kind of legislation that will actually save lives. This is the legislation that's going to make a difference. Senator Rosen, Representative Baker, honestly, how brave you are to do this. And I'm so proud to be a Minnesotan that we are taking this step. We're not afraid. I listened to the committee hearing this morning, and I heard legislators say, it's time we stop being afraid. It's time we just stand up and say the obvious. So, I mean, I'm just blown away by that. I can give you statistics, too. Basically, if we were to give everybody who died in this state a minute of silence, we'd be here 5 hours, almost 6. That's just Minnesotans. That's just last year. They deserve that minute, but they can't get it, so we're going to do this instead. This legislation is hope. It's a landmark legislation. Lexi kind of went through how it's laid out, so I won't go through that. And Senator Rosen talked about what it will fund. But what I like about it is it gives communities the opportunity to create their own solutions. I don't think I've come across a piece of legislation that does that directly. This allows communities who are experiencing things to see what their needs are in their community and ask for help to get it. And that's what's going to work. The communities are going to have to solve these problems on their own because we can't legislate this all out. We need help. I've been asked to sit on several, Montevideo just started a task force last week. Marshall, Minnesota has an incredible program they're running through their hospital right now. Dr. Devine up in Little Falls has an amazing program they're doing. So communities are coming together. We just need support and funds through this legislation. So that's what, again, makes this so unique. I, too, am mad. It's time to, since the day I lost Casey, the very day, I laid that at the foot of the pharmaceutical companies. She also had a very well-intended doctor that was there to provide her with medication because she was sick. She had been ill. That's what they were supposed to do to help her. To watch her actually live with this addiction was almost as hard as losing her. So I think, again, anything less than this legislation is an unfair message to our kids that we've lost, and Chris and Dave and so many families I've met over the last year and a half. But we can do this. Minnesota is known to be progressive and innovative. Again, I'm proud to be a part of this. I honestly didn't think I'd see it happen, and I couldn't be more happy about it. So again, they talked about moral failings. I'm so tired of hearing that. I'm confident in our legislators. I can't imagine anybody in this building not supporting this and not really wanting to create change and be on the forefront of the nation in creating this type of change, because I haven't heard about it anywhere else. So again, let's empower our communities with this legislation. Let's continue to have Dr. Devine do his program and the community in Montevideo that's starting and across because the needs in Red Lake are different than what's needed in Hennepin County, and they're different than in Montevideo or in Rochester. So again, I think empowering the communities is what I really like about this most. And honestly, it's the legacy that I would like for Casey Joe.
And again, part of this is also wrapping around our community members in the law enforcement center. Today with us as well as Sheriff Rich Stanek, who's done a lot of things in Hennepin County, and he's got a few things that he'd like to share with us today as well. So, Sheriff?
Yeah, thank you. Well, it's not often that the sheriff comes and doesn't have anything to say, but I do have a lot to say. Look, folks, you look around this room, right, from Casey to Dylan, Ariel, Senator Eaton, and Dave, your son, a number of others in the room who have lost loved ones to opioid and heroin epidemic. Tragic. I'm just simply here to talk to you about Hennepin County just as a snapshot. Hennepin County is the largest county in the state with 1.2 million in population. Last year, in 2016, we lost 144 people due to opiate heroin overdose deaths. And I'm not even done counting out the year yet, unfortunately. That's just January 1 through October 31. This morning, before I had a chance to come here, we took about 10,000 pounds down the incinerator in downtown Minneapolis and burned them. Unwanted, unused, expired prescription meds, right? Over the last 3 years, 60,000 pounds law enforcement has taken from drop-off boxes across Hennepin County, 10 of them. It is not easy to be here. Law enforcement is really good, as was said, on the enforcement side, but we also do prevention and intervention. We, last week or week before, launched the hashtag No Overdose campaign. I will do nothing else during 2017 other than what I did this morning and how I'll end my evening at civic groups and others across Hennepin County talking about opioid heroin epidemic. You heard what the doctor said, right? Very courageous of him to stand up here and say that. I heard it once before from another physician not too long ago. Engineered, epidemic. The words mean a lot. I'm grateful to be here. I've had a chance to work with these folks on a number of occasions. We started out a couple years ago with naloxone or Narcan, right? An opiate antidote. Over the last several months, 7 times my deputies alone have administered this and brought someone back from the other side. But we're not done. David, thank you very much for having me.
Thanks, Sheriff. Thank you very much. Thank you. And our final speaker today is a person who actually gets in the ambulance and actually tries to save people every single day. And Nathan, if you would come forward and share your story, and then we'll be open for questions. Thank you.
Nathan, I do work with HCMC, but I'm just going to preface everything today by saying that these are my personal opinions and not those of Hennepin County Medical Center. I am a paramedic, but the first cardiac arrest I ever worked wasn't in the back of an ambulance, it was in my home. 16 years ago, I woke up to the sound of my stepmother screaming. My brother, someone who I loved, was laying in the basement dead from a heroin overdose. As a family, we rushed to his side, we performed CPR, we prayed, we lost. Chris was a good man, a good brother, a good son, and a person who had a lasting impact on those around him. He lost his life at 21. That loss of life ripped a trench through our family for years. It profoundly impacted my parents, and it profoundly impacted me. I remember sitting in paramedic school wondering if I would ever have the chance to reverse an overdose. And when that first time came, I experienced quiet elation. I knelt before someone blue, barely breathing, and I administered Narcan. His lungs filled with air, the color returned to his face, and he snapped up from the hips like he was spring-loaded. We saved a life, and in doing so, there was a little piece of me that felt like I had righted a wrong from my past. Then it happened again, and again, and again, and I lost count somewhere around 30. I've pulled people off bathroom floors. I've dragged them out of the middle of roads, knelt by their side in fast food restaurants. I've seen some live and others die. It is far and away the most common medical emergency I respond to. It has exceeded the amount of cardiac arrests I've worked on or fatal car accidents I've seen. And while each one of these moments were different in context, at their core, they are all the same. At the end of the day, when I looked into the eyes of that person we brought back, I saw someone frightened and confused. There was the realization that they were now on their last chance for survival, but absolutely and completely unsure on what to do next. And I have tragically seen some try to end their own lives just to prevent hurting the ones that they love. I would love to stand up here today and say things have gotten better, that we have made a dent in the issue, but they haven't. In fact, it has gotten worse. And that is why I'm thankful for organizations like the Steve Rummler Hope Foundation. They've been a true compass in these directionless times. And I'm thankful for good legislation like the Opioid Product Stewardship Bill, because good legislation saves lives. This bill will save lives, but more importantly, it will help people recover. So that in the future, when I reverse an overdose, I have not simply extended that life by a day, but I have provided a path to the help that they so desperately need.